Hi everyone, Dr. Hadeep Kataria here for iDoc Social, and today I'd like to talk to you about incorporating dry eye into your practice. So whether you're thinking about opening a cold star or whether you're thinking about bringing dry eye into your established practice, this video is for you. The first step that I might recommend for you is to understand how many of your patients you've seen maybe in the past 1 year or 2 years who you have already diagnosed with dry eye. So you can do this by pulling a report in your EMR system and looking specifically for diagnosis codes or ICD-10 codes, such as dry eye syndrome of bilateral lacrimal glands, maybe punctate keratitis, some of these other dry eye masqueraders, meibomian gland dysfunction, and or blepharitis. Understanding how many patients you've already diagnosed in your clinic will give you a very good idea of what percentage of patients may respond to treatments when you incorporate them. My next tip is to really invest in good diagnostic imaging, whether that's a meibographer or anterior segment imaging. You can do this through investing in a meibographer that has a dry eye suite that also measures tear meniscus height, non-invasive tear breakup time, maybe even corneal topography. In terms of anterior segment imaging, I really think that a picture is worth 1,000 words to the patient to really get them to understand their disease process. Picturizing that SPK or neurotrophic keratitis or some of those corneal changes can just be so altering in helping patients understand their disease process. And then of course you need your vital dye staining. So what I would recommend is instilling sodium fluorescein strip and Nissamin green at the same time so that you can save time throughout your dry eye consult. Take pictures and then show those pictures and review all of the findings. Review ocular telangiectasias, review lid wiper epitheliopathy, EBMD, SPK, so patients really understand and start buying in to some of the treatments that you'll talk about later. The $1 million question I always get is, do I need intense pulse light therapy in order to treat dry eye disease? And the answer is no. You already have the tools in terms of procedures, punctal plugs, therapeutics, such as cyclosporin, some of our topical steroids, some of the other topical medications that we have available to us. You do not need an IPL machine in order to treat dry eye disease. Is it nice to have the option of IPL? Yes, absolutely. As you're building your dry eye clinic, it's only natural to start thinking about what instruments might be helpful. IPL is excellent for inflammatory dry eye disease, as well as Demodex and ocular and facial rosacea, of course. We have many options for thermal evacuation of the glands. Sometimes we can combine the IPL with thermal evacuation and expression of the meibomian glands. We also have low-level light therapy that can be helpful, as well as radiofrequency. In summary, my best advice when incorporating dry eye into your practice is really starting to understand whether you have candidates for some of the treatments before you incorporate them into your dry eye protocol.